This video is for basic facial, and it starts as if I've just gotten to work. So the first thing that I do when I get to work is I wash my hands. I wet my hands at the sink, and I get a coin-sized amount of liquid hand soap, and I wash them down to the wrist. And I wash the back of my hands down to the wrists, and I wash my fingers, and I wash the back of my fingers. I wash my fingertips and my nails. I wash between my fingers. Wash between my fingers and my thumbs. I wash my thumbs. I wash my wrists, and I do all of that interlocking washing for a minimum of 20 to 30 seconds, and then I rinse my hands underneath that running water, and I do that until I've gotten that good proper rinse. Then I grab either disposable paper towels or a towel, dry everything off thoroughly. If it's paper towels, it's going in the trash. If it's a towel, it's now dirty, and it will go into a closed container until time for laundry. And then I find 70% ethyl alcohol hand sanitizer, and I sanitize my hands. And then I have to prepare my room for my client for a basic facial service. So I'm going to review what needs to be done for that. So I would be disinfecting my workstation, bed, and equipment, using a disinfectant wipe, and following manufacturer's instructions. I want to get all of my prep done before my appointment actually arrives, so that I am prompt and respectful of their time and mine. We both have schedules, and it's very professional, and you just want to do everything you possibly can before your client gets there. Then I check my equipment to ensure that all devices are in safe working order and plugged into a working receptacle. I gather clean supplies needed for that facial service, stored in a clean closed container. I turn on the hot cabbie and stock with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. I fill a clean steamer glass with distilled water, and I preheat the steamer. I dispense products needed for the service according to skin type and client's needs as follows. I prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula, close the lid to the product, and set the portion cup tray on the tray. You'll drape the facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and headband on top of the first towel, along with a rolled towel to support the head and neck of the client. Save the 3rd towel to lay across the client's décolleté. So I'm going to show you what I've done to prepare my tray ahead of time. I have everything that I need, and then of course if I need to adjust anything, or I don't know my client's skin type, etc., I can at least have everything prepared and then just have out what I need to then dispense and then put away, so I'm not wasting any time when my client comes. So I have 4 squares, I have 2x2s, cotton rounds, makeup remover, cleanser, exfoliant, massage, mask, eye cream, moisturizer. I have water, I have astringent, gloves, because we're going to use gloves, disposable gloves for extractions. I have a brush for my mask, and then I have the wooden stick Q-tips that I'm going to be using for extractions, and I have toner. So everything is ready to go. I just need to do my meet and greet with my client and client consultation to see if everything's okay for the service, and we can proceed from there. So we're going to review that flow, client consultation, and just note that when I approach my client, I'm always going to be doing this with perfectly clean hands. So I've washed my hands upon starting work and preparing the room. I would have clean hands to greet my client. Then of course I'm going to do a hand wash again before I start the service. So let's just review client consultation. We would greet our client when they arrive and escort them to the work area, determine the client's preferences, assess the client's needs. We can assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, to prevent from safely performing the service. We'll assess the client's consultation form for any medications and products used within the last 72 hours and we'll consult on any known allergies. We'll consult with the client on any facial surgeries within the last 3 months, and if the client is under a physician's care, we'll assess if the client is prone to cold sores or fever blisters. We'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. We'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. And if the client is free from any of the above contraindications, we can move forward with the procedure. I'm just going to talk a little bit about that. You really need to take the time to go through all of your client consultation form, discussing any medications, looking at the effects that they might have on the skin, obviously any health concerns, allergies, if there's anything that they're allergic to that might be in your product or might affect the skin. So much here that's important and does not need to be rushed over when you are working with a real person, and you need to make sure that you're doing the right thing at the right time because you are their skin expert. So thankfully, our client doesn't have any contraindications. She's not on any medications that would affect her facial. She hasn't had any surgery. She hasn't been using anything like alpha hydroxy or beta hydroxy acid. She hasn't had any filler. So things are looking good. So we're going to proceed, and that means that we need to get our client comfortable on the facial bed. So we would be giving her some privacy. We're taking her into the room and then showing her where her drape to change into is, and then she can get comfortably in the bedding. And then you'll knock on the door, and when she says it's okay, you'll come back in, and then we're going to get her a little even more comfortable. So we're going to use that rolled up towel, and we're going to place it underneath her neck. And then we're going to take the other towel and place it on her décolleté, just giving her a little extra coverage. And then of course we have a hairnet here that we're going to cover up her hair and keep it out of the way of her face for the service. And before we can begin service, we need to wash our hands again. So we would go to the sink, wet our hands, find that coin-size amount of liquid hand soap, and we would wash our hands down to the wrist, and then we would wash the back of our hands down to the wrist. We would wash our fingers, and of course we would wash the backs of our fingers. We would wash our fingertips and our nails, between our fingers and our thumbs. We'd wash our thumbs, we'd wash our wrists, and we would do all of that interlocking wash for a minimum of 20 to 30 seconds. When we feel like we've gotten everything clean, we would thoroughly rinse our hands underneath the water. And when they're rinsed, we would grab either disposable paper towels or a towel, and we would turn the faucet off. If it's paper towels, towel or paper towels, dry your hands. If it's paper towels, they're going in the trash. If it's a towel, it's now dirty, and you'd put it in a closed container until time to do the laundry. And then of course you're going to get your hand sanitizer that is 70% ethyl alcohol, and you're going to sanitize your hands. And then you can begin to perform the service. So the first step in your facial is going to be makeup remover. Some people are going to wear more, some people are going to wear less, so just be mindful of that when you're going in for that makeup remove. And just do what you need to do. You will be using cleanser too, so that will help, but you need to use makeup remover for the makeup. Eyes and lips. want to do the initial cleanse, the first cleansing. And you can go ahead and remove that first cleanse. And then we're going to do our skin analysis. So we've got to cover up her eyes. So we're going to do that now, before we bring in a magnifying lamp or a Woods lamp. And I don't have one of those here, so we would be bringing one of those over, and we would be turning it on, and we would be really analyzing the skin and the neck and the décolleté if that's part of the service. But we're looking for a lot of things, and this is where we do want to spend time with an existing client or a new client. We are going to be looking for things that maybe they have told us that they were concerned about in our client consultation and also on their form, whether it's something like dehydration, fine lines and wrinkles, hyperpigmentation, redness, it could be rosacea, acne, excess sebum. I mean, the list could go on and on. So this is what we're going to be taking our time as a skincare professional to look through the magnifying lamp and really analyze the skin. There are many reasons that we take our time and really look around for this. One is for the service today. We want to make sure we do the right things for the client at that moment so that they get the maximum benefits. Number two, we're going to be able to suggest and recommend at-home care products that are going to support what we're doing today and in the future, and also their goals for their skincare and your goals together as a team to get her optimum or his optimum skin health. And then also for your professional record. So it's either in your client card, if that's how you keep your files, or your software system. you are literally going to be documenting things like freckles, moles, areas that you're working on, or areas that you want to improve, or things that you see. Because if there are some changes, you may be the first person that notices them, and then can also suggest or recommend your client see something that might be out of my scope of practice. Like if there's a change in a mole and they need to go to see a doctor. So things like that are really critical. So this is where we take our time. So we have done a really good proper skin analysis. So we would turn the magnifying lamp or Woods light off and take it out of the way. And then we can uncover their eyes. And we would be able to do cleanse number 2 if needed. And this client is a glamour girl, so she definitely we need to take that extra time to make sure we get her really good and clean. Get the skin nice and fresh for the service. And then we're going to do our third and final cleanse. once you're finished with the cleansing, you're going to use toner to tone. And I am going to make sure that my nozzle does not touch my little sprayer doesn't touch my little squares here. After you tone, it would be time to exfoliate. So I'm going to take a little pea-size amount of exfoliant, and I'm actually going to spread it around on the face. And you're going to, based on what you select, what type of exfoliant in your facial, we're going to always avoid the eyes, the nose, and the mouth. Physical or chemical, you would apply it and then follow manufacturer's directions. So I'm doing a physical. I'm going to massage it in for 1 to 2 minutes first. And once you've done that massage, you'll be able to then move to the next step, which I'm going to walk through with you because I don't have the equipment, so we're just going to talk about it. So with your exfoliant on, and you've massaged it in, you would be getting the facial steamer, and you would turn that steamer to the on position, but you want to position it near the bed, making sure that it's facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, you can position the steamer 16 inches over the client's face, aim it at the client's chin for even distribution on the face, and allow the unit to function for 3 to 5 minutes. Then you're going to remove the steamer from the client's face, return the steamer to its previous location for disinfection. So just reviewing that, we would bring that steamer that we had preheated and set up before the client even arrived. We'd bring it over to the facial bed, turn it on, making sure it's not facing the client, and then let that even outflow of a mist happen. Once that happens, we can turn it towards the client's face, aim it towards the chin, and it needs to be about 16 inches away, and then the even flow is going to go down over the client's face, and you're going to let that happen for 3 to 5 minutes. So For the sake of the video, obviously we're going to move forward and we're going to pretend like that time has elapsed. Once you're done with the 3 to 5 minutes, you're turning it away from the client. You return it to the location that you got it from and turn it off. And then it's time to remove this exfoliant. I also don't have a cabbie of hot towels. So what I'm going to do here is pretend like I have a hot towel. I'm shaking it out because it's super hot. And then I'm going to check the temperature on my wrist. It feels good. And then I will check it on my client's collarbone, which she says it feels good. And so I'm going to take the towel to the client's face. I'm going to leave the nose out. And then I'm going to apply that steam towel to her face. And it's probably going to stay warm 20 to 30 seconds, so you don't have a long time with it on here. When you start to feel it cool down, you can take it off, just giving a little gentle pressure. And then once you remove that exfoliant, you're going to really want to dry your hands off because you're going to move into extraction. And you have to wear gloves for this, disposable gloves. So once your hands are dry, you can put your gloves on because it's super hard to put gloves on with wet hands. And there's a couple ways that you can do your extractions. You can take cotton rounds and you can soak them in astringent, and you can have them around your fingers, and you can do your extractions and just work your way around the cotton round and then toss. I'm going to use the wooden stick Q-tip method, which means you would take a pair of the wooden stick Q-tips, they'd be soaked in astringent, and then you two would be doing an extraction, and then tossing it. So you have to get new ones every time. Thankfully, my client doesn't have a lot of extractions that need to happen, so we're going to get that done. So we're going to soak them in the astringent, just a little bit around that nose area, a little congestion there. So every time I use some, I've tossed them and get a new set. And with extraction, you don't want to do it any longer than about 5 to 7 minutes because it can be uncomfortable for the client, and we want the client to feel happy and comfortable. We don't want her to feel unhappy and in pain, obviously. That should do it right there. So once you're done with your extractions, however long that takes, you can remove your disposable gloves and toss them in the trash as well. So all that needs to go in the trash immediately. And then we are going to tone. So the next step, so you've got exfoliation, extraction, and tone. Um, once again, being mindful not to touch the sprayer to my cotton rounds for keeping everything nice and disinfected. And then the nice thing about after you do extraction is that you get to go into the massage part. Now, if someone has severe acne, you're not going to be doing a lot of massage or something like that. So just be mindful of all those things for your client. And one thing to note about the next step with massage is that you want to make sure you have enough of your massage product before you start the facial massage so that you don't have to go back and get more of the massage product before you finish. That would be distracting to the client. You want the client to really be able to relax and enjoy this part of the facial. It's just as important as all the rest of the treatments. So make sure before you start the massage that you have enough of your product. And that way you don't have to, hands don't have to leave the client ever when the massage starts. massage product. And then we are going to apply a facial mask. And I'm going to use my brush to do it. Of course, whenever we apply anything like this, we're always going to avoid the eyes, the nose, and the mouth. And like anything else, of course, you would be following manufacturer's instructions. And for all intents and purposes, we're going to say that this would stay on anywhere from 5 to 10 minutes. Because we are doing video, we will not wait for 5 to 10 minutes. We're just going to pretend like that time has elapsed. So it's going to be okay now for us to go ahead and remove the mask. And now we're going to do a final tone. not touching, of course. And then we can apply skincare. So we're going to do a little tiny bit of eye cream. We're going to use a ring finger to apply it. It's our most delicate finger. And so we're going to take a little bit on the zygomatic arch and the brow bone, just real gently tapping it in. And then we'll finish with moisturizer. It's nighttime, so we're not going to use one with SPF, although we have discussed the importance of SPF, and she is going to be going home with some SPF today. So this way, when she goes home, she won't have to do any skincare this evening. She'll be ready and good to go. I'm going to apply that everywhere, a little bit on the décolleté, the neck, the face. And then finishing up with her facial, we would be giving her some privacy so that she can get dressed in her clothing. And she would be meeting us out at the client waiting area so that we can review her aftercare, any maintenance, go over the results. She's in love with how good her skin looks. We'll get her booked for the next service based on goals and what we've done at this service, what our plans are. We're going to get her products to go for her at home, getting her checked out for that because she's with herself more than she gets to see us in service. So we want to make sure she's maintaining all this good work she did today. And then we have to get ready for our next client who's also coming in for a facial. Last client of the night is getting ready to come in. So what we have to do now is we're going to go back to our room. She's been checked out, and we have taken any single-use items that might be here, and we are going to discard them if we haven't already. We're going to find any implements we might have used, and we're going to put them in a closed container that is labeled to be disinfected. All the sheets, the towels, the bedding that we've just taken off the bed will go into a closed container for laundry that we're going to do later, and then we need to clean up. So we're going to identify a cleansing agent that we can read the manufacturer's directions, and we are going to read and follow those directions for mixing and usage. We're going to wipe down our workstation and area to remove any debris. And then we're going to identify a disinfectant that is bactericidal, virucidal, and fungicidal, EPA approved for use in a salon setting. We're going to need to put on another pair of disposable gloves because we're going to need to wear them for that product. We will follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. We will disinfect electrical equipment like the steamer and store it in a clean area separate from other implements. And then you can take off those gloves and throw them in the trash because it's time for us to do that final hand wash. So you're going to wet your hands at the sink, and you're going to get that coin-sized amount of hand soap. You're going to wash your hands down to your wrists, and you're going to wash the back of your hands down to your wrists. You're going to wash your fingers, and you're going to wash the backs of your fingers. You're going to wash between your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your fingertips and nails. You're going to wash your thumbs, and you're going to wash your wrists. And you're going to do all of that proper good rinse and wash under the water for a minimum of 20 to 30 seconds, and then you give it a real thorough rinse off. Get your paper towels or a clean towel, turn the faucet off, dry your hands off. Paper towels will go in the trash. That towel's now dirty. It can go in that closed container with the other dirty laundry until time for that later. And then you can go ahead and start getting set up for your next client, which is a basic facial. So this concludes the basic facial video.